All right. Good evening, everybody. All right. Good evening, everybody. I hope and believe that we did have a nice day, and I'm just going to give every one of us 5 minutes to get settled and for few other students to join us. So in the meantime, let me just say for those of us that I can see new, okay, I can see Esther was not here last week. In the interest of those of us that were not here last week, I made a quick announcement last week that students are expected to put on their video on the commencement of the live class presentation. And secondly, learners are also expected to have gone through the page, the VLE page, download the PowerPoint instructional videos, and go through it before the live session so that we can have a good facilitation interaction. Don't forget, like I said, from the day one of this course, that this is not the normal lecture face-to-face method. This is the first.
What did you touch?
Okay, so as I was saying that there is need for us to have an interaction in this session, and the only way we can achieve having good interaction between your facilitator and yourself is when you have gone through the material before the live session. Always, every week, we normally post, upload the PowerPoint video on the unit we are going to cover prior to the live session. And so it is compulsory. It is not optional for students at all. It is compulsory for students to download the PowerPoint video, go through it, pen down some question that is not clear, so that when we come to the live session, students can ask questions and we can interact together. So it is very important that you go through the materials that is provided on the VLE page before the live session. Please kindly do that in case you have not been able to do for the for the last session we've had. I discovered that none of the students have been able to go through the materials before the live session. Olayemi, kindly put on your video. It is compulsory for me to see the student I'm interacting with. That is why my video also is active. So students should put on their video. Please kindly do that. Those of us that we've logged in, it's not enough that you log in. You have to participate. It's part of the assessment. Those are the few announcements that I have. And I want to also say that on the VLE page, I've posted assignment. Please check the assignment and also attend to the assignment. All this would make up your assessment at the end of the semester. Please kindly participate in all these activities. There is a forum discussion on the page as well, where I've thrown in questions, and I expected interaction, reaction from the learners. You have to look at it and respond. Thank you so much. Hopefully others will join us as we progress. This week we are looking at, can anyone from the audience tell me what unit we are looking at today? Can you type on the chat the unit we are covering today? It's been posted since yesterday on the VLE. Can anyone remind me or remind the class what unit we are doing now?
Unit 3.
Unit 3, all right. Please always respond using your chats. All right, thank you. We are doing Unit 3, and in this Unit 3, we are on week 4. Don't forget that we are on week 4, and we are covering Unit 3 of NSC 303. And this Unit 3, the title is Health for All. Health for All is the title of the unit that we are going to be covering in the next, within this 1 hour. It's going to be an interaction, so it's going to be more of a question. And I will appreciate if you can respond to my question. And so some of the questions will come in form of a quiz. So only those who participate, only those who respond, who answered and put on their answers on the chat page will be given the marks. So be informed that when questions are asked, it's a form of a quiz and it's going to be rewarded. So it's left to you, or is your choice if you choose to respond or if you choose to answer or not. And so we have for every unit or for every topic that we cover in this course, it has a learning goal. And so quickly I'm going to share with us the learning goal for this unit. And I'm going to share my screen for you to see the learning goal. That at the end of this unit, at the end of this course, learners are expected to have covered, to be able to respond to these questions. So I'm sharing the, okay, I've introduced the topic. I said we are on Unit 3, topic Health for All, and the learning goals. The learning goal says that after studying this unit, learners should be able to define health for all. That is the topic we are covering today. Learners should be able to define it. And so also in the course of the discussion, I'm also going to quiz you on this. Learners are expected to be able to discuss the meaning of health for all. Aside being able to define or give definition of health for all, you are also expected to be able to discuss the concept of health for all, describe the global strategy of attaining health for all, as well as explain the national strategy adopted to achieve the goal of health for all. Also list the targets and achievements in health for all. And finally, learners are expected to be able to discuss the role of nurses in support of health for all. And so for the introduction on this, like I said that earlier on, okay, in Unit 1 and Unit 2, we covered primary health care and the prerequisite for primary health care. That was what we covered in Unit 1. And in Unit 2, where we covered the definition of primary health care, the component of primary health care, the principles of primary health care. And in this unit, we are going to be looking at, also in Unit 2, we are able to identify that the primary health care concepts, by the definition that was given during the Alma Ata Declaration in 1978, we're made to understand that health should be available for all, it should be accessible for all, it also should be affordable for all, and it should be acceptable for all. It's very important. The 4 A's is very important under the definition of primary health care. So that takes us or propel us to this unit, which we are looking at as health for all. What do we mean by health for all? When we say health for all, we will understand that from the concept of health for all, okay, the definition now, it's simply a global way of making health services available for all the citizens or all the people, both in the rural and the urban areas. And you agree with me that that 80% of the population of our nation are dense in the rural area. True or false? Can you respond on the chat?
True.
80% of our 80% of the population are in the rural area. And in this rural area, you will discover that health facility or good healthcare systems are not always available in the rural areas. And so that is what actually gave birth to the concept of health for all that was proposed to be achieved by the year 2000 AD. And so the definition, it simply means a holistic or is a holistic approach of health given to the population, as in everyone, irrespective of your status, whether you are poor, whether you are rich, whether you are in urban area or whether you are in the rural area, whether you are in the remote area. So the focus is for the nation or the government or the leaders to be able to provide healthcare services to everybody without discrimination. We want to remove the idea of inequality towards health accessibility. And so that is in general, in a way, touched on the definition and the concept of health for all. How did it emphasize? You understand that in our unit 2, where we said that the definition or the idea of primary health care was also established or resolved because people in the rural areas are not having access to healthcare facility, and that is where the population, the larger population of the nation is concentrated. And that was why the government and the WHO come up with the idea of health for all. Sorry, I'm just going to quickly share my slide on the next point. We've covered the definition. We've covered the definition of health for all, as well as the concept of health for all. And so we are going to the next point, which says that there is disparity in health and socioeconomic between rich and poor, within countries and between countries. You see that there is a large disparity between the educated and the uneducated, even in the health status of someone living in the rural area and someone living in the urban area. And during the introduction, I've made mention of it, that the underprivileged are concentrated and in the rural area, and they are made up of the 80%, 80 to 45% of the population. But meanwhile, WHO, I mean the World Health Organization, said this gap is too wide and they want to close the gap. And one strategy or one objective to close the gap between the disparity between the rich and the poor, between the urban settler and the rural settler, is health for all. That is, accessibility of every citizen to healthcare facility. So they emphasize that by the year 2000 AD, the individual or everybody should have healthcare services in terms of they should be able to have both social and economic power to healthcare services. And so we also looked under still, don't forget that we are still under the concept of health for all. And so we also said that among the concepts before this year 2000 AD was the basic concepts that everyone must have access to health care. It must be available to them and they must be able to access it. And in 1977, when there was a World Health Assembly in May 1977, the concepts were emerging, and it was said that, oh, by 2000 AD, everyone should be able to have access to healthcare, and it must be available to them. And for it to be available to them, it means that they must take healthcare service to people in the rural area. And that is where the idea of this primary health care occurred. All these concepts has been a progressive one. And the reason is individuals or people are beginning to express their displeasure, their satisfaction towards the disparity between the health status of people in the urban area and people in the rural areas. And so before we proceed, let me raise this, the definition and the meaning of health for all. Like I said earlier on, is an holistic concept or holistic approach of looking at healthcare service to the citizen or to the people of a nation. And so in one sentence, if you are asked what is the definition of health for all, it simply means a holistic concept. A holistic concept is an holistic concept of attaining a level of health care that enable every individual to have a social and economical productive life. And so don't forget there are keywords to it. It is a holistic concept, and every individual in a nation must have a social and productive life. Must have a social and productive life. Must have a social and productive life. So far, is there any question or any clarification you would like me to make based on what we have covered so far? Like I said, this is a facilitation. This is not a lecture, and so students should interact with their facilitator. So, any question? Any question? Okay, silence means no question. I hope when I do ask my question, there won't be silence. Okay. So as I was saying, that the definition, it implies the removal of obstacles. The government and WHO do not want any obstacles. Okay. Yusuf, I'm seeing Yusuf hands. Okay, let me.
Yes, ma. Hello, ma.
Okay, I'm seeing your hands.
Yes.
Can you post your question, please? Can you use the chat and post your question? All right, I'm waiting to see your question on the chat. Few minutes to the close of the class, I'm going to unmute everyone so that we can respond. But in the meantime, please post your question on the chat. Thank you. Is that clear, Yusuf? Okay. I assume you've heard. Okay. All right, then, as I was saying, that the definition means the removal of an obstacles. The removal of an obstacles that prevent people from accessing is primary healthcare the same as health for all? No, no. PAC is not the same thing as health for all. PAC, like we covered last week, it's simply a way of getting healthcare services to the community, and these healthcare services must be accessible, must be available, must be affordable, and must be acceptable. But health for all is an arm or is an arm of primary health care. What do I mean? It's a subtopic under primary health care. And that is why in the definition, I said it's an holistic concept. And it is a way of removing obstacles. And we will see as we progress in the study, what are these obstacles that the government is expected to remove. We want to remove the obstacles of the rural or the community member not being able to access health facility. Many are living in the remote area where they don't have healthcare services at all. And so those are the obstacles that you want to remove. But I hope I've been able to answer your question. PAC is not the same as health for all. But it doesn't mean the same thing, but they are related. They are related. All right, so we progress in our discussion that all right, then we move to the next slide that says strategies of health, strategies to achieve all this. We've looked at the definition that it is a way of enabling a person to lead a social and economic productive life. We've also looked at the aim. The aim of health for us is to be able to get people to have access to healthcare facility and be empowered socially and economically for them to be able to maintain a good health. And so the next slide talks about strategy for health for all. What are the strategies? We want to look in Unit 2, we've looked at the strategy for achieving or getting healthcare services to people. So we looked at it that in 1981, Global Strategy of Health, Global Strategy of Health for All was involved by WHO through consultation with countries, regions, and at the global level. We understand that, as we have seen in under Unit 2, the Alma-Ata Conference called on all governments to formulate national policy, strategies, and plans of action, and set down the principles of healthcare, which is the basic of health for all. And so it was followed by individual countries developing their own strategies for achieving healthcare for all, and synthesizes of national strategy for developing regional strategies. So we have strategies at global level, at national level, and at the local level. At global level, what is it all about? The global strategy for health for all is based on the following fundamental principles. What are these principles? The principle is that health, principle 1, is that health is a fundamental human right and a worldwide social goal. The existing gross inequality in the health strategy is of common concern to all countries and must be drastically reduced. People have the right and the duty to participate individually and collectively in the planning and implementation of their health care. Government have a responsibility for the health of the people. Country must become self-reliant in health matters. Health is an integral part of the overall development of the countries. Energy generated by improved health should be channeled into sustaining development of the country. Better use must be made of the world resources to promote health and development, and this will help to promote world peace and prevent conflict among our nations. And so we have seen the global strategies. We've seen the global strategies of the nation. There is the global strategy to achieve health for all. Of course, we see that we are now in 2021, and this strategies has been put in place or has been going on since 1977. So we can see that it's an ongoing project, but the focus is to achieve the goal. However, we have not yet achieved it, but then there is plan or strategy or objectives of achieving these strategies. And so we see that government has the responsibility to provide health care service to the citizens. The health, the human being has the right to health, and the government should not deprive or should not in a way prevent an individual or a community from having this fundamental human right. The fundamental human right of a person is to have health. And it is the sole responsibility of the government to make this available. And the resources of a nation must be used or channeled towards acquiring this strategy. And so we've looked at it at the global level. At the national level, what is it? I'm seeing a question here. Since the goal for Health for All is year 2000, does it mean that we are supposed to be free from all diseases, or there are specific with regards to that? Okay, if you understand, if you have gone through the PowerPoint video that is earlier sent on the page, and of which we are still going to cover in this live session, it doesn't mean that by the year 2000 AD, that the nation will be free of diseases. No, that is not the aim of the concept. The aim of the concept of Health for All is for every citizen to be able to have social and economic productive life. What do we mean by social and economic productive life? That you can afford the healthcare service, that you can access healthcare service, that it is acceptable to you based on your culture, and that is accessible to you. And so it does not necessarily mean free of diseases. No, it's not free of diseases. Because even now we are in 2001, no nation can say they are free of disease. No. But the idea or the essence of the concept is for individual, irrespective of your status, whether you are poor, whether you are rich, whether you are elite, or whether you are educated, you are uneducated, whether you are in urban area or whether you are in a rural area. You should be able to have social and economical productive life. You should be able to afford healthcare service. That is the aim. You should be able to have access to healthcare service. So that's the essence. Thank you, Abdul Bakr, for that question. And so we proceed to the national strategy. At the national level, don't forget we've just looked at the global level. Now we want to look at the national level. And when we say national level, what do we mean by national level? So we looked at it, and I'm just going to share my screen on that point of national strategy for Health for All by 2000 AD. And Mahatta Declaration and Nigeria commitment to Health for All by 2000 AD resulted in the formulation of National Health Policy. The federal government of Nigeria convened a national conference in February 1988 to discuss the national strategies and action plan to achieve Health for All. In July 1988, a working group on Health for All to involve national strategy for implementation of healthcare programs to move towards the goal for Health for All by 2000 AD, and to suggest suitable indicators to monitoring the progress achieved from time to time. The working group submitted its first report in the year 1989, which was accepted by the federal government of Nigeria now. Thus, the national health policy was involved by government of Nigeria in 1989, which commits the government and the people of Nigeria to achieve the goal of Health for All in 2000. And so quickly, I'm just going to ask, for those of us that we are live on the chat, which year did Nigeria make a commitment to be part of Health for All goal? Which year? I just mentioned now that at national level, at national level, we, we also made a commitment to be part of Health for All. Okay, 1998, okay, 1998, 1999, I'm seeing 1990. Officially, we have it in our policy, the policy of Nigeria, to be committed to the goal of Health for All in 1989. Yeah, it's in 1989. But the committee was set up in 1998. The committee was set up. All right, thank you for your response. So that moves us. What are the steps? What are the steps? What are the steps, or what are the importance of this national goal? So we want to quickly look at it. Okay, before we look at the importance of this policy, of the national policy of Health for All, we want to also look at the policy itself, the policy of Health for All. What does it contain? On the screen here, you can see the health policy in Nigeria has the following key elements. 1. Creation of a greater awareness of health problems in the community and means to solve this by the communities. Supply of safe drinking water and basic sanitation using technologies that the people can afford. Reduction of existing imbalance in health services by concentrating more on the rural health infrastructure. Establishment of a dynamic health management information system to support health planning and health programs implementation. Provision of legislative support to health protection and promotion. Concentrated actions to combat worldwide malnutrition, research into alternative methods of healthcare delivery and low-cost health technologies. And lastly, the health strategies include restructuring the health infrastructure, developing health manpower, and research development. And so you will see these are what the policy contains, the policy on Health for All. These are what it contains. And so quickly, the important indicators to achieve Health for All. And at national level, in the policy, we are saying that what are the indicators to achieve Health for All and the importance? Number one, we want to look at reduction of infant mortality rates from the present level of 87 to below 60 by 2000 AD. 2, to raise the life expectancy at birth from present level of 58 years to 64 by 2000. To also reduce the crude death rate from the present level of 10.4 to 9, and to reduce the crude birth rate from present level of 27 to 21, to achieve a net production rate of 1 by 2000 AD. And lastly, to provide potable water to the entire rural community. And so we have seen the importance of this policy. And under this importance, number one, we said to reduce what? For those of us in the chat, What are the 5 important indicators of achieving health for all? For those of us that we are in the chat, can you list the 5 indicators to achieving health for all? You see, the essence I'm sharing my screen. The essence of sharing my screen is for you to see and follow along. And so, don't forget, okay, to reduce mortality rate from what to what. I mentioned the rate. It's also important in case you are asking an exam or the question comes in your assignment. Don't just say to reduce mortality rate. From what ratio, from what rate to what rate? So I mentioned it that from 87, okay, I expect, okay, yes, reduction of infant mortality rate from 87 to 60, yes. So there are 5, okay, to reduce birth rate from 27 to 21, okay. I'm expecting, I'm seeing, okay, as you are posting your response, we'll continue on the next slide, which talks about this, that you must be aware that during this, you must be aware that during the 6th and 7th, steps were already undertaken to implement the strategies outlined in National Health Policy. And we want to look at these steps that were being looked at. One is to establish one health sub-center for every 5,000 rural populations with one male and one female health worker, to establish one primary health center for every 30,000 rural populations, and to establish community health centers, to train village health guides, to train traditional birth attendants, to also training of various categories of health personnel like multipurpose workers. These schemes are expected to ensure the availability of adequate infrastructure and medical and paramedical manpower to take us nearer to the goal of universal provision of primary health care as emphasized in the National Health Policy. And so you will see that at this level, at the national, at the global and the national level, the aim is for everyone to have access to health. And so, and you can achieve this with infrastructure alone. And so we need manpower, and that is the essence of the training of manpower. I want to look at the role of nurses in all of this. The nurses profession is so essential that for a nation to achieve its goal, the nurses, the role or the part or the responsibility or the role of nurses is very essential to achieve health for all. And so we want to look at nurses' support in achieving health for all. And so quickly on the slide here, it's captioned Nursing in Support of Health for All. In 1979, WHO and International Council of Nurses, ICN, conducted a workshop in Nairobi on the role of nursing in PAC for leaders of nurses associations, in which the commitment of the nursing profession to the goal of attaining health for all by 2000 was formally confirmed. Subsequently, National Nurses Association plan their own strategies in relation to their own national health policy. The National Association of Nigerian Nurses and Midwives also participated in this exercise. Then, in 1981, an informal meeting was convened in Geneva by WHO on November to consider the role of nursing in contributing to the achievement of the goal of health for all through PAC. Strategies and action proposed for change at national and local level. And so I want to just quickly look at the steps that involve these strategies that is proposed, both at the national level and at the global level. One, it's development of corps of well-informed nurses. Two, nursing at policy and decision-making level. Nursing practice in primary health care. Fundamental changes at all levels of nursing education. Research in nursing and administration practices and education. And so you will agree with me that for the nation to achieve health for all, the role or participation of nurses was deemed vital. And for them to actually get the contribution of nurses to achieve this, that is why they are involving nurses at policy level. Nurses are represented. So you will see that even in research, nurses are represented. So what do we mean by developmental of corps of well-informed nurses? Gone are the days that nurses are known as gallipot nurses. At every phases or at every area of decision making, you will see nurses there, because nowadays you have professors in nursing. In research, you find nursing there. In administration, you find nursing there. In clinical setting, you find nursing there. And so the essence of the development in each country of a corps of nurses that is well informed about healthcare and ready to bring necessary changes in nursing system is to bring about changes. You also have inclusion of nursing personnel at all levels of policy making, so that nursing profession can also look as how the national goal can be achieved, and the role or the part nursing profession can play, the involvement of nurses and the use of their skills. So nursing skills is required to achieve the goal of health for all. Then we looked at fundamental changes and research. I just said that in all phases of programs, you will find nurses there. And so furthermore, we look at action proposed at national level strategy. Under development of corps has two sub-themes that is discussed there, which is arranging and developing a series of international, national, and regional workshops or other meetings that will bring together small groups of key nursing practices, professionals for orientation and guidance in planning for primary health care in their own country. Developing texts, guides, and communication aids, which will include review of current publication related to PAC and production of specific materials to nursing in PAC. And so we've just looked at the rest is to unpack each of these. And so, okay, I'm seeing to provide safe water, all right. And so we've looked at the 5 nursing supports in achieving healthcare facility, health for all. And so you see that we mentioned that there was a conference that was held in Nairobi. Of course, out of thousands of nurses that we have at national level, maybe one or two will represent Nigeria there. So it is those who, those who represent the nation now come back home and organize a workshop or a seminar at each state now level. You also get a representative from the state level that will go back and also train people at the local level. So you can see that is a progress. Is a progress. And so far we have covered the definition of health for all, the concept of health for all, the strategies for the strategies of achieving health for all at national and global level. We've also looked at the role of nurses in supporting or achieving health for all. So at this time, I want to welcome question and contribution as we round up our live session for this class. Question, contribution. If there is anything that is not clear or you would like me to throw in light on, please post your question. I will also appreciate your question. Like I said, this is a facilitation. This is not a lecture. And so you are expected to contribute and share your thoughts on what we have covered. I always emphasize the only way you would effectively interact in class is when you have been able to go through the resources, the materials, the PowerPoint video. Even if you cannot go through the course outline, it's always advisable that you go through the PowerPoint video. It's more elaborate. And so please don't depend on the 1 hour live session. The 1 hour live session is so compressed that will not help you to prepare for exam. But if you are able to go through the video and also join the live session, then you are empowered to better prepare for your exam. Can you throw more light into development of corps of well-informed nurses? What we mean by development of corps of well-informed nurses, like I said, that in 1981, that is it in 1981 that nurses had a conference, International Council of Nurses, ICN, had a conference in Nairobi. And these delegates, the delegates will be representative from each country. Nigeria will be represented maybe by 1 or 2 nurses as delegates from Nigeria. But after the meeting, the agenda of that meeting, they are expected to bring it back home and train other nurses on the agenda. Then it becomes the policy. Then maybe at federal level they are represented. They come home, they train at the state level. Then those that they train at the state level, they are committed to go back and train people at the local level, at the local government level. That's why you are developing corps of nurses, corps of informed nurses. So it's like a ladder. Well, will I say ladder? Is more or less like organizing seminars or workshops. And that is why I think in the slide that I showed on that, let me just quickly share that that slide, okay? That slide that expatiated where I said that it is divided into two. Yes, yes. Development of corps of well-informed nurses has two requirements. The two requirements are arranging and developing a series of international, national, and regional workshops or other meetings that will bring together small groups of key nursing practicing professionals for orientation and guidance in planning for primary health care in their own country. And two, they are also asked to develop texts, guides, and communication aids, which will include review of current populations related to PAC and production of specific materials to nursing in the PAC. So far that is the meaning of development of corps of well-informed nurses. I hope I've been able to answer that question. Any other question? We have 4 minutes. Let me quickly, please, ma, we will need the recording of the previous facilitation. Okay, it's well noted. In the previous facilitation, the recording is already on the VLE, on the VLE, I mean. So that one is there. The only one we don't have, the only recording we do not have is the first class interaction that we had with NNC 303. This is our 3rd meeting, although we are in the 4th week. But remember, the 1st week we could not meet because it was public holiday. So this is our 3rd meeting, and I'm assuring you that the video for the last for Unit 2 is on the page already. Feel free to download it. But I want to say that the PowerPoint video and the live session will help you. Don't concentrate on one. And so if there is no question or contribution, I want to call it a day. It's 6 now, and I want to say thank you for coming. Kindly, please ensure that you download your materials. Your assignments are posted on the page. Do your assignments and post it back. It will be marked for those of us who have responded on the charts here. It will also be rewarded. It has scores. Thank you so much. See you next week, same time, same day. God bless.
Thank you, ma. Bye-bye.
Bye.